Good morning and welcome to my world update for today. Subtitle is Road Trip and the 100 Club. We'll get right into it. First slide is a list by state in the US of the death rate per 100,000. Now, if you go back and look into the most recent years of the flu season in the United States, you'll find that a really bad flu year, if I'm remembering correctly, 2014 was a bad flu year, and for that flu year the death rate was 20 individuals per 100,000 population. So this first list is the list of states that are over 50 deaths per 100,000 from COVID at this point. You'll note that New York City is listed separately at the top of the list, and New York is further down. The New York City number is not listed inside the New York number. So that New York number is without the population of New York City. Just gives a sense of how difficult it has been in New York recently. But state-wise, the state with the worst death rate so far is New Jersey. So New Jersey, Connecticut, Massachusetts, Rhode Island, New York, District of Columbia, Louisiana, Michigan, Illinois, Delaware, Maryland, and Pennsylvania are the states that have had death rates above 50 per 100,000. And again, remember, this number is just going to keep increasing because the population doesn't change that much, but the deaths continue day to day. So I put this slide up there kind of to point out to some people that don't think this is worse than the flu, that it really is. Then on the bright side of things, these are the states that the death rate from COVID is half of that 20 per 100,000 number that I cited, which would be a really bad flu year. So these are the states that have not been affected that badly yet. I think as you go through this list, you'll notice that it's also kind of coincides with the states that are kind of wide open and depopulated, which I'm certain helps, because the more crowded people are in a virus that spreads through aerosol and droplets, the less crowded a place is, the less communication you're going to have of the disease. So I'm not going to read off this list, but suffice it to say that these are the states that are suffering the least to this point. So now I'm going to start into my road trip. I'm going to be traveling after the July 4th holiday on business, some essential requirements in order to keep some labs running around the country. And so I'm just going to do a report on the states that I'm going to be visiting while I'm on my road trip. First state is the state of Colorado, and you can see that after the initial spike in Colorado at the spin up of the virus, that they were in a nice downward trend. I'm assuming due to their lockdown, but you can also see that since second week of June they've started a short-term upward trend as well. So nowhere near the height of the cases that they had, but they're definitely marching upward. And another note while we're on this slide, see the 400 number. Today the cases in New York City area are 400 new cases, and I put that in there just to kind of gauge. The entire state of Colorado doesn't have as many new cases as New York City had today, which is worth noting. Gives you an idea of the scale of things. This is the state of Texas. I apologize, I forgot to write that in there. There you go, state of Texas. And you can see that Texas has really taken off. They've been in an upward trend throughout the virus, I think because they kind of did a, I don't know, what would you call it, shutdown light. But Texas has really started an upward trend starting from about June 7th, and I think they may have had the highest number of cases in the country today, new cases. So it's not looking good in Texas. Truth be told, that's the place that I'm worried the most about on my trip. This chart here is Louisiana, and this I took this chart. The blue line here is a 7-day average, so it's a smoothing of the data. You can see the first big hump on that, and if you recall, at the onset of the pandemic, Louisiana and the New Orleans area were one of the areas that was highly affected. People believe because of the crowds during the Mardi Gras, but they actually came down and had leveled off nicely. And again, remembering that 400 cases per day number from New York, the entire state of Louisiana was hovering around that on a daily basis for the whole state. So they had brought it under control pretty nicely. But again, that after that first week of June, we've definitely got another big increase in cases. And yeah, it's difficult to tell whether that's Memorial Day parties or it's due to the protests that happened, or if it's just simply due to the states relaxing and starting to go on about their business. Here we have Mississippi. This is the next state in line, and this one is also the chart essentially across the term of the pandemic. Interesting to note in the Mississippi is that to me, as I look at that, it doesn't look to me like they had any appreciable shutdown at all, because they have never really decreased the number of daily cases. It's only been a continual increase. Mississippi is one of those states that, because of their low population by nature, they're spread out. That 400 cases that I cited for New York, they're just barely starting to get that for the entire state. But it does. I'm not even really seeing a beginning of June upswing in this. It's just a gentle curve upwards, and I see no reason to believe it's not going to continue in this state. I haven't seen anything in the data that suggests that, but relatively lightly affected overall. This is the state of Alabama, and Alabama's chart, the black line is the cumulative cases. So that's the line that what you're looking for there is the slope at any given time. Is the slope like that, or is the slope like that? And that'll tell you whether you're having an increased incidence rate. And then the bars on the chart are the daily case count. Alabama is another one of those states that has just seemed to have a pretty gentle uptick, but then right around the end of May or so, we started to get an upward growth. And versus Mississippi, Alabama is looking quite a bit worse. Here we have Florida, and Florida is another state that has really spiked. Florida also didn't have much of a shutdown, so they had a gentle slope up. They never have really started to reduce the case count, but recently in the last week or so, they've just taken off. And I think actually, if I'm remembering back to that Texas slide, it looks to me like Florida has more cases per day yesterday than Texas did. So not good. I was looking at the county map of Florida too, trying to decide where I was going to stay while I'm working in Miami, and looks to me like it might be beneficial to drive an hour west of Miami and stay in a place that has a little bit lower case count. So then this last slide is what I've just coined today, the 100 Club. This is daily new cases per million people. Now this is a logarithmic chart to get a little bit of spread on the lines, and it's also 7-day rolling average. So you'll see South Africa didn't quite make the 100 line, but that's because of the 7-day rolling average. If you look at the daily data, they're just over 100 cases per million people. So these are the 4 countries in the world right now that are leading in incidence rate. In other words, how what's the percentage of the population that is getting insignificant. And we also got a note on here that explains why Chile took that big bump up on that day, June 18th. It was because earlier cases that hadn't been put into the total were put into the total, and I assume that we're still seeing this up here because of the 7-day smoothing. So Chile right now has the highest incidence rate per population or per capita in the world, followed by Brazil, then the US, then South Africa. So that's the presentation for today. There's a huge debate going on about masks and whether they should be worn, whether they should be required. I recommend, if you haven't seen it, take a look at my video, Hamsters with Masks. It explains a test that was done, a study that was done, that pretty much conclusively showed that masks are effective against the coronavirus, and they're most effective when the person who has the virus is wearing one. But since a person doesn't know whether they've got it or not until they get really sick, it's always best to wear a mask. So as always, wash your hands with soap and water. If you don't have soap and water, use hand sanitizer. Wear a face covering, a surgical mask, something to cover your mouth and nose in all public places. People say, I feel like I can't breathe. You can breathe, you'll be able to make it, but wear the mask, because if you cough and you're infected, you're going to infect other people. And if you care at all about other people's lives, you need to wear a mask. You could save your own life, but more importantly, you could save the life of hundreds, if not thousands, of others people. And please tell your friends to do the same. Thanks very much for watching.